Hi, my name is Harry Roscoe, and recently, as little as 10 days ago, I was a patient of Dr. David Mayman at the Hospital for Special Surgery in New York City to get a total knee replacement. I wanted to do this video for two reasons. Number one is to explain to people how easy it is now with the new technology and a great surgical team to have a wonderful experience in knee replacement, almost totally pain-free, and to explain to people that if you're having any consideration of not having it because you've heard bad stories about pain, etc., put those aside, listen to what I have to tell you, and then go talk to your doctor. And if you have a chance, go see Dr. Mayman at the Hospital for Special Surgery in New York. This whole thing started for me back 2 years ago. I was having problems with my knees and a lot of pain in my knees, and I went to the doctor and we went through the whole cycle of doing the shots, the lubricants, etc., and we finally ended up doing arthroscopic surgery about a year ago. It lasted about 5 months, and it was for both knees. And I went back to the doctor in January and said, "Doctor, this isn't working. What can we do?" And he said, "Look, you're too young to get a knee replacement," which kind of surprised me. And he said, "What we can do is probably do some more lubricant shots." Wasn't happy about that, so after I left, the pain started getting worse, and I talked to a friend of mine. He said, "I've been to the Hospital for Special Surgery in New York, and I had a great experience down there. Why don't you go talk to them?" So I decided maybe this is something I should pursue. I did some research on the hospital. I did some research on who the different surgeons are down there. Dr. Mayman has one of the best reputations for the least number of infections and the most positive outcomes of surgery. His manner with his patients is wonderful. He spends as much time as you need. He explains things on a level that you need so to make it an overall great experience. So I'm going to go a little bit into what I went through, and keep in mind I am on the 10th day after my surgery. I'm walking fine. I'm walking without a cane, though don't tell that to my therapist because she'll hit me with that cane. She wants me on my cane, and I ice a couple of times, 3 times a day, and just feeling great and pain-free. All started, the cycle for the surgery started on May 6th when I went down to see Dr. Mayman for the first time. Spent some time down there getting x-rays to look at my knees, and got in there to see Dr. Mayman. He looked at it and he said, right away, he said, "You need 2 new knees." And I said, "Well, that's exactly what I thought." I said, "But I was told by a doctor in Connecticut that I was too young to get knee replacements." And he looked at me and he said, "Well, I don't know what he was referring to, but our knee replacements last 25 to 30 years. We're using the latest technology, and we've been very, very successful." So he spent some more time answering our questions, and at the end I said, "Well, that's fine, but I need both knees replaced." And I asked him, would he do both knees? And he looked at me and he said, "Yes, we would." He says, "It's more traumatic on your body, and we're going to have to do a little more rigorous exam on you." And I said, "Fine." And I said to him, "But what would you recommend?" And he said, "If it was one of my family members, I'd recommend one knee at a time." In retrospect, great decision, okay? I've already had this one done. I'll go back in about 6 to 8 weeks to get the other one done. All right, so the day's over. I went into the admin's office. She actually scheduled my surgery and my pre-surgical screening. On May 21st, I went back to the Hospital for Special Surgery, and I'll call it HSS from this point on, and I did my pre-surgical. And I've got to tell you, it was extremely thorough. First thing that happened is I was given a complete physical. I was given EKG, chest x-ray, x-ray of my lower body, urine analysis, blood work, you name it. And actually, if you're ever thinking of getting a Pritikin physical, don't bother. Get your knee replaced anyway instead, because you'll get a better physical there. I'm just kidding. But we went through all that, and then after that, I was cleared for the surgery. They did a blood count to see how much iron I had in my blood to make sure that I could replenish my blood, and if I didn't, they would have me either give blood or look at possibly doing transfusion if I need it. As it stood, my blood count was good. I didn't require any blood transfusion. I didn't require any blood. I was fine. I didn't even have to take iron tablets. So after the physical, we were sent into a class for about 2 hours. And during that class, they give you a publication called Your Pathway to Recovery. It is the Bible of knee replacement, explains the entire procedure, how to prepare, what happens during the procedure, and how to take care of yourself after the procedure and what to expect. And they tell you right up front during that class, keep this with you at all times, even when you come into the hospital. In retrospect, I can see why it was a very valuable tool. You can tell that HSS has spent a lot of time making this process streamlined, efficient, and very complete and good for the patient. So we were in a class, and we were also informed that we are going to be assigned a team, of which we are a member of that team. And that team was made up of my surgeon, Dr. Mayman, my physician who gave me the physical, an anesthesiologist, and a pain management physician, as well as my operating room nurse. And as a team, we were working together to make sure that this was as successful and as painless a surgery as possible. So I left that day, and my surgery was scheduled for the 31st. What you have to do the day before the surgery is you have to change your diet a bit, not drastically. I mean, that day I had salmon and risotto for supper, and I had a hamburger for lunch. It really wasn't that different. But there are things that they want you to stay away for prior to the surgery. After 8 o'clock that night, I had to go on liquids up until 3 hours before surgery, at which point I had to cease and desist all consumption of any type of liquids. So I got to the hospital the following day at 11 o'clock. The surgery was scheduled for 2 o'clock. They escorted me into the room where there was a gurney. I changed into my gown. And one by one, the surgeon, the anesthesiologist, and my whole team came in, and we talked, and they answered any questions I had and explained what they were going to do again. Dr. Mayman came in. He actually autographed my knee with a magic marker. And I actually mentioned to him, this is the kind of doctor he is. I mentioned to him, look, doctor, I've had problems with my ITB, which is a band that goes from your knee to your thigh. And could you take a look at it while you're doing surgery? He said, absolutely. Now, I can't be quite sure, but I actually think he took magic marker and he wrote ITB right on his hand. Anyway, so he left, and the next time I would see him was at the surgery, and the anesthesiologist came in, and that was kind of funny because he said to me, well, Mr. Roscoe, we're going to put a catheter in you, and we're going to put a needle in your back and give you an epidural. An epidural numbs you from the waist down. It actually paralyzes you. And they also put a IV line into my hand. He says, what we're going to do is we're going to give the epidural, and we're going to put a needle in your back for the epidural and to pump morphine in afterwards for pain management. Okay? And also they're going to give me an anesthetic to knock me out. And they're going to put a catheter in for, post-surgery and during surgery. And I looked at him, I said, are you telling me you're going to put a catheter? Do I have to be awake for any of this? He says, well, yeah, you have to be awake for the epidural and you have to be awake for the catheter. And I looked at him and I said, this is not exactly something I want to do. Can't you put me under? He said, don't worry about it. He said, you'll never know that we did it. You'll just forget it. And so what happened is the pain management doctor came in and physician, and he explained what he was going to do. Afterwards, they wheeled me down to the operating room, completely sterile environment. And I don't know if I mentioned this before, but I believe they actually operate in space suits. I didn't get to see the whole thing because I was out cold, but I know from the past, I think they operate with helmets on, with rebreathing. They're very, very concerned about infection. And at this point, I will tell you that New York Hospital for Special Surgery is probably got the lowest infection rate, which is very important in TKR, knee replacement. They've got the lowest in the United States. They wheel me in, they put me on the operating gurney, and I'm getting ready for them to stab me in the back with a needle, and I don't know what happened, but usually if you have anesthesia, you've got about 2 seconds to realize that they're going to put you out, and you're laying down. Honestly, I don't remember anything. I don't even remember going to sleep. The last thing I remember is I was sitting up on a gurney. I woke up, I was in the recovery room, I had felt no pain at all. I was feeling great. I was still numb from the waist down, had the needle in my back and everything, and like I said, no pain. And then I had the morphine drip. They kept me there until the epidural wore off and I could wiggle my feet, and at that point they brought me around 8 o'clock that night up to my room. The only thing I would tell you at this point, the morphine drip worked well. There was no pain to that point up till that night. Slept well through the night, aside from the fact that the lovely nurses there came in every 4 hours to check my blood pressure, my temperature, my oxygen levels. So you're not going to get a good night's sleep there is the bottom line. But so I was on the morphine all night. I woke up next morning. The only problem I had during the night is I kept on itching, and I didn't know why. I thought maybe the Johnny coat I was wearing had detergent on it that I was reacting to or whatever. Well, it turns out that morphine drip sometimes has the ability to create an itching on your body. So I mentioned it to the nurse. She adjusted my IV. Itching was gone immediately, and that was it. I was a little nauseous in the morning. They put some anti-nausea medicine in. And I was feeling fine until I tried to eat, and she put the anti-nausea medicine in. Maybe half an hour later, I was able to eat. Again, here I am the next morning after the surgery, no pain at all. Now I'm going to take a moment because now I'm after the surgery and I'm through with that section of the staff. Let's talk about the hospital staff. I had probably 3 or 4 nurses during my stay there, and I had nurses' aides, and I think there was a couple other personnel. I've got to tell you that I've never met such warm, caring people in any hospital environment I've ever been in. When somebody pressed that call button on their bedside, you didn't wait half an hour for anybody. They were there, all right? I mean, you are their top priority. They're just absolutely wonderful people. I was so impressed. I was actually, towards the end of my stay, walking down the hall with my walker, and everybody you passed in that hall, whether they knew you or not, looked up at you and would say, "Good morning. How is your recovery going? I hope it's going well." Right down to a fellow who was washing the floor. I was so impressed. This tells you, maybe they're having the people do this, but it's telling you the attitude of the hospital, the attitude of the people who are taking care of you. All right, so getting back about 4 o'clock that afternoon, the day after the surgery, again, I felt no pain at all. They said, "We're taking you off of morphine, Mr. Roscoe. We're going to put you on tablets, but you have to ask us for the tablets so that we can gauge how your pain is and how long it's taking between medications." So I did that, and I will tell you in the hospital, while I was there, I did religiously every 4 hours ask for it, whether I needed it or not. One key thing here that we're told is if you're experiencing pain at a level 0 and it starts to go to a level 1, don't wait till it gets to a level 5 before you ask for pain meds, because it takes a while to kick in. The minute you sense a change in your pain level, you ask for the pain med. So I went to the pain med Saturday afternoon. I took those, and I took them on Sunday morning. Sunday morning, they gave me therapy. The young lady came in, wonderful person, and her name was Rebecca, and she got me up on my walker, and she said, "Let's see how you do walking." And I said, "Fine," and I just went walking about 200 feet right down the hall. And I came back. I felt great. And again, no pain. I came back, and she said, "Mr. Roscoe, I only wanted you to take a couple of steps. I'm sending you home this afternoon." So here I am. I had the surgery Friday afternoon at 2. I was home Sunday afternoon at 2 o'clock. Again, still no pain. Didn't want to take any chances, so Sunday afternoon I did take a pain pill. Sunday night I took one when I went to bed. That was a week and a day ago. I haven't taken a pain pill since, except for twice when I had physical therapy. When you have physical therapy, very important, take a pain pill about an hour before your therapist comes. Your therapy will go a lot more smoothly, and it'll be done with a lot less pain. All right, so just try to remember that. So, in summation, it was a painless procedure. At night when I go to bed, sometimes I get a little bit of an annoying pain, but not enough that I'd want to take even an aspirin. My therapy's been great. I do have some pain when she's bending my knee at 120 degrees. But all in all, it's been an extremely positive experience, and I really have to attribute it to, number one, I had a great surgeon, Dr. David Mayman. I had a great hospital who really cares for their patients. I had a great team that worked with me, stayed with me every stage of the game, and was mostly concerned with my pain management, my comfort, and to make sure everything goes all right. And then the post-surgery stay in the hospital with the staff there was phenomenal. Not to say that my bed was overlooking the East River. I laid there watching the boats go by. The food was probably as good as the Marriott, so it was a very positive experience. So in summation, I want to say this. Number one, if you're going to get this done, and somebody tells you how painful it was for them, go talk to your doctor. Go try to get to HSS to get it done, because they're wrong. It can be done almost pain-free. Your outcome can be 100% positive. Second thing I want to do, I want to sincerely thank Dr. Mayman and his staff. I want to thank the pain management physician who did a great job, the operating room folks, the anesthesiologist, and even the recovery room nurse who stayed with me the whole time. So all in all, extremely positive experience. I'm actually looking forward to getting my next knee done, hopefully in 6 to 8 weeks, and I will be right there back at the hospital for special surgery. That's it. So if you have any concerns at all, put them aside, go get it done, and you'll be a happier person. Thanks.